Good morning, everyone. Thank you for joining us here in the Commons as well as at home. We're going to start with a moment of silence and opening reflection from Steve.
On this beautiful day, let us just pause for a minute and let us open up our hearts and minds to this moment of conversation. We know your Spirit is among us, and may you open us up to this moment to hear and listen and to be renewed. Amen.
Amen. Thanks, Steve. So this morning I have one topic that we'd like to talk about the majority of the time, and certainly leave this open for other discussion, and that is the recent rise of COVID on campus as well as in our community. And so I've invited Carrie Davis and Rachel Blazer, who's our infection nurse, to come speak to us a little bit, talk to us about the memos that have been sent out recently, what we're up to with the local Department of Health, and what we're learning. And then I'd like to hear from you all if you have any questions or suggestions. This is still something that is with us, that will be with us for a long time. We try to get it right in terms of communication, in terms of timeliness and being directive, but sometimes it's a fluid situation, so we need to just bear with us as we are learning with the local Department of Health exactly what's going on in our particular community. So Carrie and Rachel, I'll invite you up to present, and then we'll open it up for questions.
Good morning. And I also wanted to share that Hanifa Rhodes is with us as well. So if there's any additional questions regarding clinical services, that we can hopefully address some of those this morning. This weekend, we sent out our first memo with an exorbitant amount of positive cases, the largest that we have sent during this entire pandemic regarding our campus. We did also send a memo yesterday with a couple of new cases. And if you noted at the top of the memo, we did indicate in working with the local health department, we were also retesting individuals who had been previously identified as positive. And that's something the local health department is working through with us just to confirm, because it's a significant amount of positives. We've also been working with the lab and sharing that information with the health department. It is really the health department that helps direct from a number standpoint if the originally reported positive cases remain positive or if there's evidence that they were false positives. So that is why the memo also indicated if we get further direction, we will share that with you. We are testing today. We're testing tomorrow. We tested yesterday. Let me get straight on what day it is. Today's Tuesday. We tested yesterday. We do expect the test results from yesterday, the PCR test, to return today. Unfortunately, we don't have control over the timing of when those results come in. And we also do need to share with the health department and have them weigh in before we message anything, potential change or confirmation of the original test results. So that messaging may come out tomorrow. I know that the infection control team does have a meeting with the health department tomorrow. They did have one Monday, so in addition to a lot of communication, phone and electronic, they've been having face-to-face Zoom meetings as well. So I wanted to let you know that we are investigating that because it is a significant number. That being said, it has been advertised that this particular variant is very quick to share. So it is one of the variants that spreads quite easily, and it's something that we want to make sure everyone is aware of. And yes, make your own decision for how protective you want to be, that you're comfortable with, but know that if you aren't feeling well, if you have any symptoms that are new in the last couple hours last day, whether it be congestion or headache or just really feeling weak, that you should be concerned that you might be symptomatic and should remain. And I'll pause a moment because I'm sure he'll announce that again. So as I was saying, if you have any symptoms, you do want to remain home and call for a test to be done. We do have a lot of residents have been doing home tests, and that's certainly an opportunity as well. But you can still contact the clinic nurse, and we can arrange for a test for you. We can come and give you a point of care test, which is the quicker 15-minute test, or we can do the full PCR test, which we send out and we get back the next day. With those tests, if the staff, Covenant Wood staff is coming to test, we can come in and we can test, but that's all that we can do. So if there are questions about what medications should you take, what you should do next, we are not going to be able to tell you specifically. We would have to guide you to your family physician or to Dispatch Health or to, in the near future, the telehealth through EMS Medical Center, because we are not able to prescribe. So if you're interested in just having that test, we can help with that. If you want more information about what to do regarding symptoms, then we would recommend and help put you in touch with another resource. From a protocol standpoint, and that was the second memo, if you will, that was shared yesterday, we are operating under two different, determined locations from CDC. We do have our healthcare and our assisted living in Manor East that fall under healthcare facilities. Healthcare facilities does get broken out a little bit more between hospitals and long-term care and some residential living, but for the most part, it's the same under healthcare provisions. Independent living falls under community provisions. You are here independently, we're not providing medical services, and so as an independent resident, as an independent entity, we follow the guidelines for such, and they are different. We reiterated yesterday in Manor East that there will be masking for staff and vendors, volunteers in Manor East. We are wearing the N95, so that is a big change from the traditional surgical mask that we were wearing just a few days ago. Visitors are welcome into Manor East, though it is recommended that you only visit if you need to, just because we're looking at the increased numbers of positivity and wanting to minimize any potential spread. But also when you come to visit, you will be visiting only one person per day. So it wasn't, but just a couple days ago, I could come over and visit if I had friends and neighbors who had transferred for short-term stay in healthcare. I could go and visit one after the other in the same morning and then go on my way for the day. That no longer is the case. I need to go in, and when I sign up, put which one person I'll be visiting for the day, go and visit them. I can leave and come back, and when I come back, I can visit that same person, but just one person for the course of that full calendar day. And that's part of the intervention to help with tracking that has been strongly endorsed by the local health department, along with their recommendation that if it's a visit that is not necessary, to consider postponing it. In independent living, you will note that for masking, it is still voluntary. We do put that it's strongly encouraged because that is still recommendation from the CDC if you're going to be in a gathered location, but it is not a requirement. How we respond to positive tests are slightly different in both localities, and they do have a strong bearing on whether or not the individual is symptomatic. So whenever you end up with a positive test in independent living, we still strongly encourage you to call the clinic nurse so we can set up services for you and also walk through what the local health department is currently recommending for your protection and the protection of others. Lastly, just want to reiterate, if we're not feeling well, please do not walk around campus coughing, sneezing, or just not feeling well. Definitely wear a mask. Call and ask for those clinical services to come to you. And also make sure that if you're having any type of symptom and you're being protective, that it is important to wear your mask properly. And so if you want to get the full benefit of the mask for your protection and the protection of others, we do want to make sure that it completely covers not just our mouth, but also our nose. And that, depending on the mask, sometimes might need readjusting. But Rachel, as our infection control nurse, is also available to help with recommendations of how to adjust masks, because they all are a little bit different and different ways to put them on. So if you have any questions, we can help with that as well. At this point, having highlighted most of what we put out in publication, as well as that we are working with the local health department continuously and have another full-scale meeting scheduled tomorrow to assess where our positivity rate stands on campus. Are there any questions from those of you that are here at the moment? Okay, we'll give you the mic just in, thank you.
I might have missed it because I wasn't, not sure I heard everything. But independent living, the folks who work in independent living, are they required to mask or not?
In independent living, employees are not required to mask. They
Right.
fall under the community guidelines.
See, I think that's a mistake because these folks are the ones that had the highest instance of infection.
Thank you. And if somebody's listening online and not able to hear, the comment was a recommendation to basically rethink employee masking in independent living. That's an abbreviated version. Would you agree that encapsulates the message? Okay. Yes, sir.
When I get these COVID-19 memos, the numbers that are out there that say for independent living, and it goes over and says residents, it's 44. I understand that this is a cumulative total from when we started that back in May, I think it was. It would be more beneficial to me anyway, I don't know about anybody else, but I would like to know that on the day that that particular memo is prepared, are there 4 people in independent living that have COVID or are tested positive for COVID? It could be maybe another column over to the right-hand side of that, just one more number. You know what the number is anyway, so can you put it on the paper for us?
And regarding adding extra columns, and we'll certainly take that under advisement. In the memo itself, the very last paragraph on the memo before all of the before the table at the bottom. It does specify the total number of individuals by level of care and type that are in quarantine, and that would give you who's actively positive at that point in time. So when we sent this out yesterday as an example, in quarantine, it did indicate residents, but it did not separate it out by Manor East or independent living, and that is something that we could certainly look at, but we do try to give you a snapshot of what's happening today in addition to any new cases. But thank you for that comment, and we'll continue to look at that. Any other questions this morning? I'm going to open it up for Rachel and Hanifa if either had anything that they wanted to share this morning.
Some of you folks I've never met before. I just wanted you to put a face with the name and the number that's always at the bottom of these communication forms. I will go off of what Carrie has mentioned. We have a wonderful C19 team here at Covenant Woods. We do meet weekly on top of the great relationship that we have with the health department. Even when things are going smooth with the health department, we're still meeting with them. So that wonderful relationship we have is really great to have. And they've assisted us through this whole process. It's been we're taking it day by day, but it's been quite a task. Do you guys have any questions for me? Yes. And VDH. But there's two ladies that we work with all the time. They're always checking in on us, making sure we're up to par. We go for them to any type of question just to make sure we're doing what we need to do so we can give you the best care possible. But that's all that I have. Again, my name's Rachel. I'm the one that's always at the bottom of these forms.
Good morning. So I'm Hanifa. I'm the nurse Oops. Oh my gosh. Okay. I'm in the camera now. Sorry. Good morning. So I just wanted to kind of piggyback off of what Carrie and Rachel said. I know in the independent setting, we're not mandating that you wear a mask, but when you come to the medical center for any care, or if you have questions, if you're picking up a form, we do ask that you wear a mask just so that we're keeping that area as clean as possible. And then as soon as you exit either the exam room or the center, you can follow the guidelines already in place for independent living. Does that make sense? If anybody has questions about that. Okay. If you do, feel free to come to the medical center. We have forms. We can help you fill them out for intake or have any other questions. Okay? Thank you.
All right. If there's no other COVID-specific questions, just on another update of what's going on campus, we are working, as you've heard, with a dentist to start services in Manor East. And she's been able to spend some time on campus and start putting together the instruments where she wants them and looking at some other items that she wants to bring in. So we're doing a lot more of that last minute setup, and we hope to be able to announce shortly her official schedule. But I just wanted to let you know that that does continue. And though it's been a definite work in progress, very shortly she will be here on a scheduled basis to see residents, primarily in Manor East to start, but we will continue to add as her schedule allows. I think that was the only announcement I had.
Thanks very much. Thanks, everyone. We do have other directors who are here today. If you have any questions for them, we have Tim and we have Aaron. We have Mike, and we have Lori, and also Steve, as you know. So if you have any questions for them this morning, we can certainly open the floor for that, or questions for me.
I have a question for Tim. I
Okay.
think this Tim. How is the path in the woods and around the lake, are the mechanisms for our whatchamacallit,
Pendants, the
Sarah.
Sarah pendants.
Are they checked recently so you know that it's always working?
Yes, ma'am. Actually, that's something that Karen takes care of in IT. She gets a report every single morning to make certain all of the transmitters are online,
Thank you.
as well as pendants and smoke detectors. So she sees it all.
Thank you.
Yes, ma'am.
How about critters in the woods?
That's Tyler. Tyler watches critters. Ah, that's not good. That's interesting. Anyone else?
All right, thanks, Tim. Any other questions for any of our directors this morning? If not, we will adjourn. Thank you for your time. Oh, one more question from the audience.
We saw in the manifest that came out yesterday that we're talking about considering the pool use by Westminster Canterbury in exchange for the shows or something over there. Just listening to people talk in Fireside last night, there is some concern about that. We know us. We know what we do. We don't really know what they do, which is a terrible way to put it. But how are we going to be sure that these folks are non-COVID positive coming in? Or are we just going to take Westminster Canterbury's word for it? Or are we going, I mean, we're not only talking about the pool, we're talking about the showers, the dressing rooms, and so forth.
Yeah, you raise a very good point. I believe we're just taking Westminster Canterbury's word for it. They're following the same guidelines we are for independent living. Doesn't mean we can't have some additional requirements to make sure that folks are testing before they come. And that could be the simple POC rapid test to make sure that they're negative. So let me bring that back to Megan, who's organizing that, to see if that's an extra measure that we can put in place. I appreciate that feedback. If you have additional feedback about that relationship, and again, it's going to be about 2 years, we're hoping to have some good synergy between their residents and ours. I think we can learn a lot. They can learn a lot as well. They'll have their own staff member available. But since it will be a bit of a long-term relationship, I would suggest that if you have suggestions for Megan, just let her know, email her or call her, and then we can work it out before they arrive. But that's a very good suggestion. I appreciate that. Okay, hearing or seeing no other questions, we'll adjourn for the day. Enjoy the rest of it, stay cool, and we'll see you next time.